Morning. Thank you for being here. I'm Dr. Doug Auld. I'm from McAlester, Oklahoma, and I'm president this year of the Oklahoma Dental Association and currently chairman of the 2002 Oklahoma Mission of Mercy. There's some thank yous we'd like to give out today. First is to Lieutenant Governor Todd Lamb for being here today. We'd like to thank the Delta Dental Oral Health Foundation, who's being represented by their chairman, Dr. Mitch Kramer. We'd like to thank the Oklahoma Dental Foundation, the City of McAlester, First National Bank of McAlester, and the McAlester Regional Health Center for their support during this year's event. And thank you most of all to all the other sponsors, small and large, that have helped us finance this event. And the biggest thanks, of course, is to all the volunteers who are taking their time and effort to put on the event this year. The 2012 Oklahoma Mission of Mercy will be Friday and Saturday, February 3rd and 4th in the Southeast Expo Center in McAlester, Oklahoma. This event is free, no eligibility, no insurance requirements. There are no appointments. The doors open each day at 5 o'clock a.m. and treatment is first come, first served. Some of the treatment that we provide include cleanings, restorations, extractions, and front teeth root canals. Like last year, I don't know if you remember the snowstorm we had last year during this event. This event will happen, rain, shine, snow, no matter what. At this time, I'd like to have Lieutenant Governor Todd Lamb say a few words. Thanks, Todd.
Dr. Auld, thank you, and it's a pleasure for me to be here and participate in this announcement regarding the Mission of Mercy. Nearly half of all Oklahomans don't see a dentist regularly, and the Mission of Mercy, in its third year now, provides a much-needed service to our state. It's one of the largest free healthcare events in our state. It started in Tulsa, Oklahoma City last year, as Dr. Auld said, and then going to McAlester this year. I'm with my dentist, Dr. Kramer, and because he is my dentist, I just do what he tells me to do whenever he tells me to do it, as long as he promises Novocaine when I go back and see him. But in all seriousness, this Mission of Mercy is quite a vision. Other states do it, but no other state does it like Oklahoma. And I attended last year, and as Dr. Auld said, it was a cold day, an icy day, a very wintry day in Oklahoma. And I showed up, Dr. Kramer, what, 5:30, 6, whatever time he told me to be there. And what struck me was how many people were just waiting. Hundreds of Oklahomans waiting to receive treatment that a lot of us take for granted. And it's because the over 15,000 dentists in our state in the private sector are meeting a need out of their compassion for their fellow man in Oklahoma. So it's my pleasure to be here as Lieutenant Governor, and I want to thank the Dental Association and Delta and my good friend Dr. Kramer for his leadership in the service they're providing Oklahomans. Thank you.
Well, it's a real privilege for me to be here with Lieutenant Governor and Dr. Auld to kick off OkMOM's 2012. It represents three groups of people that I'm particularly proud of. I'm proud to be an Oklahoman. I'm proud to live in this great state and to get to work alongside Oklahomans. Taking care of Oklahomans is going to be a tremendous privilege and a blessing. I'm proud of organized dentistry in the state of Oklahoma, and I'm proud of my profession. It's a profession that I have a great deal of passion for. Being able to provide a smile or the ability to smile, to communicate, to eat, is huge. And so I'm very proud of the dental profession and what this event means for organized dentistry. But let me take just a quick minute to just brag on Delta Dental a little bit. Delta Dental is Oklahoma's not-for-profit dental company, created more than 37 years ago. It's an Oklahoma company helping Oklahomans. As a not-for-profit company, Delta Dental's mission is really twofold. The first mission to provide dental benefit programs to groups and individuals. But the second part of that mission is to provide educational programs and scholarships and benevolent dentistry, financial support for free and low-cost care for people to seek dental treatment. And it's synergized by volunteerism and community outreach programs. The OkMOM project is right in the wheelhouse of Delta Dental's second mission, which is to provide that free and low-cost dental care. The Oklahoma Mission of Mercy is an excellent example of how the not-for-profit mission and the dental professional can work alongside to provide this care. Having been a part of this project for the last 2 years, I can tell you that it's life-changing for the individuals that get treatment, but it's just as life-changing and equally impactful for the dental professionals to get to provide that treatment and to get to see those people and the lives that are changed. So in closing, just Delta Dental is so proud to support this event and to pull alongside the Oklahoma Dental Association. We look forward to a great event in McAlester and many other years to come for this program. So thank you very much, Dr. Oliver.
This is our first rural Mission of Mercy. As it was mentioned earlier, it was started in Tulsa and went to Oklahoma City. But when we started the Mission of Mercy, it was believed that we were going to take this where the need is. And I promise you that the need is great in southeastern Oklahoma. I'm going to give you a few statistics about our state and southeastern Oklahoma. In southeastern Oklahoma, there's one dentist roughly for every 4,000 people. In our state, 1.4 million Oklahomans are without dental care benefits, which makes Oklahoma the 48th state with the highest rate of uninsured adults in the United States. Oklahoma, it ranks worst in the United States for the lowest percentage of adults visiting a dentist during this past year. Last year, we saw just over 2,200 patients in the 2 days. That was served by 1,400 volunteers, and we averaged $510 per patient, and we did nearly 9,000 dental procedures. McAlester is very, very excited to host this event in February. The community has really come together, and we welcome all the patients and volunteers with open arms. Thank you again to all of our donors, the leads that help us, and all the general volunteers. Speaking of general volunteers, we still need more volunteers. We need more than close to 300 more volunteers to make this event happen successfully. And if you'd like to register to be a volunteer, you go to okmom.org to register. One final note, the GPS systems tend to not be very accurate around the expo center to find it. So I promise you there will be adequate signage off the turnpike to be able to get to the expo center. It's very close. I'd like to thank Lieutenant Governor Todd Lamb again for being here today, and Dr. Mitch Kramer for representing Delta Dental. I would also like to thank Teresa for being here. She was a patient last year, and thanks for taking your time out to be here and be with us today. That being said, I'd like to close with questions. Go right ahead.
Well, I see here that we rank among the lowest, or the lowest, for percentage of adults visiting dentists while they can't afford it. What about just apprehension? People who just, I don't want to go to the dentist.
There are actually several barriers to people receiving dental treatment. Economic barrier is one. Fear is another barrier. There's also geographic, just not being close enough to get to a dentist, not having the means to get there. So yes, fear is one of them, and we obviously take that very seriously in our profession, and even at the Mission of Mercy, we're doing everything we can to make that enjoyable.
What would you want to tell my listeners, because I'm statewide radio, my listeners they need to go to the dentist, but they just don't want to go?
I would say,
What would you tell them to allay them?
I would say that dentistry has improved so much in the last 10 years that there is absolutely no reason to not seek dental treatment due to fear of pain or any other type of anxiety, because there are so many ways to combat that with either anti-anxiety drugs or nitrous oxide or other things. I promise you there's a way to solve that problem for them.
How many people are expecting those 2 days?
We would hope to treat just over 2,200 patients again. Hopefully, I think our maximum would be close to 2,400. So.
And it's a first come, first served.
It's absolutely first come, first served. The line will start, I'm sure, sometime in the evening the day before.
It starts at 5 a.m.?
The doors open at 5 o'clock in the morning, and we treat usually till right up to 5 o'clock in the afternoon.
Governor, when you see these, we're 51st in the nation in people visiting the dentist. What are your thoughts on that?
It's obviously a challenge, Michael, but you know my background and my conviction politically, I'm not always for the next governmental mandate. We want governmental mandates inside the mouth of our citizens. That's why I love to participate and to go last year, but also participate in this press conference today, because it's the private sector coming up and meeting a need. And Calvin, just to comment on your apprehension, what was neat last year when I attended, what's the youngest patient roughly? You saw 4, 5, 6? I mean, they're pretty young last year. From that young to probably an octogenarian, when their name or number was called, they were ecstatic. Literally, they were ecstatic. And I say that, I view that objectively because as Dr. Kramer knows, he knows my dentist when I was a kid. I was terrified of the dentist. Off the record, I'm kidding, it's a press conference. I ran out of my dentist office when I was a kid. They said, Todd, you're next, and I bolted, it's a true story. I bolted out the door. I was terrified. But I got a great dentist now. But my point is, young to old, people were ecstatic when their name and number was called last year because they needed the service, much needed service, and there's been provided in a very up-to-date way, of course. But back to your point, Michael, it's very challenging for Oklahomans that we rank so low. You know, I'm very competitive by nature, and I talk about state comparison with other states in our region and coast to coast in all rankings. And we have to do a better job in Oklahoma, and Mission of Mercy is one way to do that.
Are there any other questions? All right. Thank you all so much for coming. Appreciate it.
Thank you. Oh, my pleasure. Thanks for doing this, and very nice to meet you.